Chalk City 91.1 FM, Sweet 100.1 FM, and on Facebook at TTT Live Online. We now go to the Minister of Communications, Donna Cox.
Good morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terence Dial Singh, Dr. Naresh Nandram, the Principal Medical Officer of Health, Epidemiology, and Dr. Avery Hines, Technical Director, Epidemiology Division at the Ministry of Health. The Minister of Health, the Honorable Terence Dial Singh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to my colleagues, Dr. Hines and Dr. Nandram. Very good morning to ladies and gentlemen of the media and to the listening and viewing public wherever you are. Today is Monday, 27th July, and as I always like to do, I like to contextualize where we are with this global pandemic. Ladies and gentlemen, on Saturday, a mere 48 hours ago, the world had barely crossed the 16 millionth mark as far as coronavirus infections are concerned worldwide. We had barely crossed it. Today, 48 hours later, we have added close to 500,000 more cases. We are at 16,492,814. We have added close to 500,000 cases in 48 hours. Deaths are 653,425. But I want to share with the population a little breakdown of the top 24 countries in the world that have coronavirus. 3 countries, United States 4.3 million, Brazil 2.4 million, and India 1.4 million, are in the million case group. There is one country between 500,000 to 1 million. 14 countries have COVID cases between 200,000 and 500,000. And 6 countries between 100,000 to 200,000 cases. Those are the top 24 countries in the world that are accounting for the lion's share of cases around the world. So United States 4.3, Brazil 2.4, India 1.4. Just below that is Russia with 818,000 cases. The average number of cases continues to be in the region of 275,000 to 300,000 cases. And deaths, which were going down at one point in time, are now unfortunately picking back up. So whilst up to 2 to 3 weeks ago, cases were going up and deaths were coming down, now we have both going up, deaths and cases at the same time. Ladies and gentlemen, I would have spoken about the need for solidarity at one of the earlier press conferences last week. And I said this is a time more than ever for national solidarity. A CNN update put it even better than I did. And they are saying now that the cure for COVID, outside of a vaccine, the cure for COVID is trust. So if we use the words trust that CNN is putting out, and solidarity, which I spoke about last week, we are in a phase locally where from last week, Wednesday, we started to see local cases popping up, mainly along the east-west corridor. We have to continue to trust and show solidarity with the institutions that are leading this fight, the Ministry of Health, Ministry of National Security, the TTPS, the Defense Force, all the institutions that are working together to protect you. We must have trust in the government's repatriation policy, the government's testing policy. We must also have trust in each other. And what we are going to have to do, if we are not doing it already, is to be able for each person each member of society, whether you are a leader of a place of religion, a business leader, wherever you are in a position of leadership, even leadership at the household level, we are going to have to be our own saviors in moving forward by doing two simple things that came to the fore, two lapses that came to the fore last week. And Dr. Nandram and Dr. Hines will speak to this. That is the urge, the encouragement to wear masks. We saw prior to Wednesday, Thursday, and Friday that the wearing of masks had dropped off significantly. Yes, on a cursory look around major towns, cities, we are seeing the percentages going up. However, recent photographs in newspapers of people in leadership positions not wearing masks is a cause for concern. We are all leaders in this fight. Whether you're a political leader, a candidate, a social leader, a business leader, we as leaders have to send the message that wearing masks is the right thing to do. Is the right thing to do. As we move away from the towns and cities, and I've said this before many months ago, you notice a significant drop-off in the wearing of masks as you leave Port of Spain, as you leave Sawa. And when you move out into the urban areas, the rural areas, the wearing of masks as a percentage seems to drop off significantly. All of us who are leaders at this point in time need to set the example by wearing masks. Set the example. Even if people who follow you don't wear masks, at least you as a leader are wearing masks. The second piece of advice which we want to re-emphasize again and again, which helped some of these cases prop up, is stay home if you are ill. And if you are ill, isolate yourself at home, isolate yourself from the rest of the family, isolate yourself from children, cease your business operations, don't go into your place of work, and that will significantly add to lessening the burden on contact tracing, lessening the burden on the TTPS, and lessening the burden on society so that we could keep the economy and keep the country open. So last week, as I said, I would have spoken about solidarity. And this morning, a CNN report is putting it in the form of trust. We have to trust each other at this point in time to do the right things. And as I close, before I hand over to Minister Cox, please, as a member of the public going out into the public domain, assume two things as we have been advising. Assume, one, that you have COVID, so that if you wear a mask, you don't give it to someone else. And assume that everyone around you, public transport, in the banks, wherever, in the malls, assume that they also have COVID. So by wearing a mask, you are instilling that sense of trust and solidarity that if I have it, I am not giving it to you, and if you have it, you are not giving it to me. These two simple public health measures, in addition to the others, physical distancing, cough etiquette, hand sanitization, sanitization of hard surfaces, and all the others, avoid touching your face, is what is going to keep us to continue flattening the curve. Our curve has been relatively flat. We want to continue it that way. The parallel care system is there to serve you, but we don't want to break it. We don't want to unnecessarily test it. So, Minister Cox, I want to thank you for the past couple of minutes to give these messages of solidarity and trust and to reinforce some simple public health measures that we could all adopt. Thank you very much.
Thank you very much, Minister. Dr. Naresh Nandram, the Principal Medical Officer of Health Epidemiology, will provide us with a clinical update. Dr. Nandram.
Thank you, Minister Cox. Pleasant good morning to the Honourable Minister Cox, Honourable Minister Dial Singh, my colleague Dr. Hines, members of the media and the public. Clinical status update for Monday, 27 July 2020. As of today, we have a total number of tests done in the public sector at 6,550. Total number of unique patient tests, 5,014. Total number of repeated tests, 1,536. Total number of community tests, 2,597. Total number of private sector tests done for the week ending the 27th of July 2020 stands at 1,789. So the total number of tests with both public and private sector that have been done thus far stand at 8,339 tests. As of today, we have a total number of 148 positive cases. There was one new case overnight, bringing the total number of hospitalized patients to 12. I'd just like to take this opportunity to reiterate Minister's call to wear masks. Masks really do stand in the way of preventing onward transmission of COVID-19, and I would encourage everyone to do so. In addition to wearing a mask, I would strongly encourage anyone that is ill, whether it's, as we say, just a little fever or a little sore throat. It's either you're ill or you're not. And even if you just have very minor symptoms, I encourage you, please stay home and please reach out to get tested. The hotline numbers at the ministry are 800-WELL, 877-WELL, and in Tobago, 800-HEAL. There are testing centers available at every major hospital across Trinidad and Tobago, and in addition to that, at specific health centers distributed across Trinidad and Tobago. Contact information as to where these are can be found on the ministry's website. So in summary, I'd like to just reiterate the call to wear masks, to encourage persons, if you are ill, please do not go to work. Please do not send your children to school. Please stay at home and get tested. Thank you so much. That ends the clinical status update for today. Minister Cox, back to you.
Thank you, Dr. Nandram. Dr. Avery Hines, Technical Director, Epidemiology Division at the Ministry of Health, will provide an update on COVID-19 contact tracing. Dr. Hines.
Thank you, Minister Cox. Good morning to the Honourable Ministers, to my colleague Dr. Nandram, to the members of the media and members of the viewing and listening public. What I'm going to do is I'm going to contextualize the contact tracing activity from inception to the current point very quickly, and then I'm going to drill down to some of the important public health measures that will make the contact tracing and reduction of spread more effective. As we would note, we initially had in the first phase or wave, as we described it, 116 persons who were tested positive with links to travel or contact with persons who traveled. We then had a contact tracing activity around all of those persons, identifying those with whom they were in contact, quarantining, testing, and ensuring that there wasn't onward spread. We had a period of relative calm for about 4 weeks. During that period, we began to repatriate nationals. And in that process of repatriating nationals, we did detect an additional 28 persons with COVID-19 positivity. They tested positive for COVID-19, but in the absence of contact with persons in the population, there was no need for contact tracing. They were quarantined immediately, and contact tracing didn't surround their repatriation. We have subsequently seen in the last few days at least 4 persons, in fact 4 persons, who have turned up in the population with COVID-19, and one of those in tracing their contacts and testing them led to another cluster, a family cluster of an additional 5 persons, so that we have initiated again the contact tracing activities around persons with whom the positive cases would have been in contact. This grouping of persons includes household members, members of workplaces where ill people went to work, members of school groupings where children were in school settings, and then beyond that, family members of those persons. So we have been moving from the primary contacts, those directly in contact, to the secondary contact, household members and workplace members as appropriate of those directly in contacts, and in some cases as far out as tertiary contacts, in contacting these persons, advising them to quarantine, and arranging to have testing done. Now, contact, as defined by WHO, is spending a given amount of time, usually upwards of 15 minutes, in close proximity to another individual. Walking by someone casually in a public space doesn't count always as contact. So each interaction is assessed for the level of risk that it would pose in defining what level of contact an individual would have with a case, and this information is used to determine which measures are most appropriate for managing the situations around each of these individuals. So far, we have managed to contact the primary contacts of all of the cases. Swabbing is underway for the majority of these. It has been completed in some instances and is ongoing in others. We do have the additional secondary contacts contacted and under quarantine, and swabbing has been initiated for those as well. And the real takeaway message from this experience is that when instructions to remain at home, wear a mask, don't go into gatherings if you're ill, when those instructions aren't heeded strictly, we generate webs of contacts. We generate large numbers of people who then have to be locked down and quarantined. Similarly, we would like to encourage those persons who move around in the public to, as Dr. Nandram, as the Minister of Health has said, to wear their masks at all times, as this again reduces the risk of spewing droplets, which can then infect other people. In your interactions with people with whom you speak, your interactions are reduced, the risk of interactions are reduced by the wearing of a mask, which reduces the expulsion of droplets and reduces the risk of transmission. I'd like to bring 2 images up onto the screen at this point in time. Image number 1 just shows the distribution of all of the cases to date. That image will show 2 sets of colors, one for the cases that were identified having been in contact with persons. Those circles are red, and the circles that are purple, and also the cruise ship image that is seen offshore, those represent the cases that were brought in under control and quarantined immediately. You'll also see off to the right in the Sangre Grande area that star that indicated the previous cruise ship experience and the quarantine area in that location. The second map shows the web of contacts generated by those cases that were first picked up in the community. So the second map is an update of the previous contact map. And as you can see, the cases with their distribution generate a massive web of contacts, primary, secondary, and tertiary, across the entire populated sector of the map. And this is an important fact, because what we want to ensure that everyone understands is that a case in one place means contacts basically almost everywhere, because Trinidad is small and people travel around the country quite frequently and quite far. Therefore, reiterating the importance of reducing the risk in the interactions by wearing a mask, the hand hygiene, and of course, the staying out of circulation if you're ill. With that, I turn you over to Minister Cox.
Thank you very much, Dr. Hines. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us. But that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. Express?
Hello, good morning. Kim Bodram from the... Hello, good morning. Kim
Yes.
Bodram
Yes.
from the...
Good
Good
morning, Kim.
morning. We are hearing you.
Good morning. Okay, good. Thanks, Ministers, Doctor, everyone. Minister Dealsing, 2 questions, which is point blank. I think the population would like your opinion or the opinion of the medical experts outside of the epidemiological investigation. Where did the virus come from? We've been on lockdown for a while. The borders are closed. We did have some imported cases. I think people would like a clearer answer as to where exactly did it come from at this point? And also, are the safety protocols effective in schools? A lot of public concern that we were locked down when there were a few imported cases, but now we have live active cases among us. School is continuing. So are the safety protocols effective? Can we continue confidently?
Okay,
Thank
thank
you.
you, Kim. So I will take the second question and Dr. Hines will take the first question. As far as schools are concerned, let's break down the protocols for schools into 2, as the CMO would have said here. To reopen schools to prepare for SEA, and the CMO confirmed this, and I spoke to him this morning, so I'm reconfirming what he said. We shared with the Ministry of Education the protocols as laid down by WHO and UNICEF with the Ministry of Education. So that's that there. For the opening of schools in September, again, the CMO would have said, I think the Thursday before last, he would have sent to the Ministry of Education his recommendations, and the Ministry of Education is to look at it, have discussions with their stakeholders, tutor, the PTAs, school principals associations, and so on, look at it and get back to us for that reopening in September. So that is what we have done so far, and the implementation will be the responsibility of the Ministry of Education to drive it down through the system. I'll now turn you over to Dr. Hines to answer the first part of the question.
Thank you,
Where the
Minister.
virus came from.
Thank you, Minister. The question is a valid and an important one, and one that we are in the process of investigating as we speak. We do not have a clear or a concrete answer to where the cases would have come from, because we start with where the cases are and we trace backwards to identify source, while we also trace outwards to reduce spread. So in doing so, we collect information on exposures in various settings to various groups of persons, and that information helps us to understand where persons may have been exposed. That process is ongoing at this point in time, and as we do not have definitive information that can identify a point source, it would be premature to give a definitive answer on where the cases came from. But we can assure you that we are working assiduously toward identifying source to the greatest extent that it is possible. The more important thing at this point is reducing the risk of the cases spreading, the risk of persons spreading viral illness. And here again, we re-emphasize the importance of all of the public health measures that have come to be referred to as the new normal.
If I may, at the Ministry of Health, and if you go back to all the press conferences when we had that lull, we constantly said that the virus is still amongst us. I warned about that and advised about that on an almost daily basis. So what is happening to us is actually no surprise. But what is different this time around is that we are now more prepared to turn around test results, not in 1 day or 2 days, by using the gene expert machines. You would have seen with the Pennywise situation, we were able to reopen Pennywise in almost 24 hours, right? Because we have ramped up our testing capacity using the gene expert machines, so that knowing that no country can claim to be COVID free, you will get this type of situation once the economy starts to move, once people start to move and the economy starts to reopen. So right now we are more ready than we were 3 months ago, 2 months ago, to treat with these cases which we always anticipated would pop up.
Thank you. Newsday.
Hello, good morning. Can you hear me?
Loud
Good
and clear.
morning. Yes,
Thank
we're
you.
hearing you.
Yes, hi, good morning. Ryan Hamilton Davis is the name from the Trinidad Newsday. So tacking on to Ms. Boudran's question, since the cases have been coming in, there has been a lot of speculation that illegal immigration may have some kind of contributing factor to this new bout of local spread. I mean, is there any truth to this? Can epidemiology support that evidence, or is there any evidence to prove that? And we also got information of the newer case being a person from Arima. If we could get a little bit more information about that person without infringing any privacy,
Sure.
that would be helpful as well. Thank you.
So Dr. Hines said clearly just a couple minutes ago that he does not have any information as it stands now as to the source of the cases. That is why we are doing the contact tracing. And as he said, it will be mere speculation at this point in time. But what is more important to the public, to prevent spread, wear your masks. We can't emphasize that enough. The simple public health measures will help us in a great extent to prevent continued spread. So whilst we focus on identifying the cause, we must also focus on the population to do the simple public health measures. Knowing the cause is important, but what is also equally important are the public health measures about hand sanitization, wearing masks, staying home if you are ill, and so on. And Dr. Hines could probably answer the second part of the question.
Dr. Hines?
So with regard to the most recent case, without going into geographic location, what we can update you on is the fact that, again, primary contacts have been identified. Some of them have already been swabbed. Secondary contacts have been identified and have been advised to quarantine. And that public health action is the action that is going to be taken to reduce the risk of spread, limit spread in any geographic area. I think that it's a false sense of security to focus on the area from which a case arises, given how mobile our population is. A case anywhere in Trinidad means contacts everywhere in Trinidad. So without focusing on the specific geographics for one case, what we do want everyone to do is to ensure that they abide by the public health advice on removing themselves from circulation if they're ill, wearing masks when they go out into the public, and the hand hygiene that accompanies entry into most of the public spaces at this point in time. Those are the most important factors, and those are the things that are going to help us to reduce the risk and the rate of transmission in the cases that we have actually already identified in the population.
Dr. Nandram?
Thank you, Minister. To add to the contribution of Dr. Hines, I would like to delve a little bit more into the most recent case. So we can confirm that the most recent case was a 43-year-old male that presented at the Arima District Health Facility. We became aware of the case during the course of last night and have been working through the night to do the necessary. So we can say that there are at least 8 persons in the household, at least 3 adult males, 3 adult females, and 2 children. One of the children is an SCA student at the Takarigo Presbyterian School. During the course of last night, we've been in contact with the principal of that school and have advised that the school that be closed, and we're in the process of contact tracing the students and their families. In addition to that, one of the peculiarities about this case that I'd like to mention is that the individual was symptomatic for 6 days. During those 6 days, contrary to the public health advice that we've been giving over and over again, this individual did not stay home. What ended up happening is this individual went to work, and we are in the process of testing everyone at work that he's been in contact with this morning. And in addition to that was a delivery driver, and there's several other companies that we have contacted and will be continuing to liaise with regard to testing persons that may have been exposed and sanitization as need be. So that I hope summarizes and addresses Mr. Davis's question.
Thank you very much, doctors. ACP News. We're not hearing you, Prior.
Hi, you hear me?
Right.
Good morning.
Yes. Loud and
We're
clear.
hearing now.
Yes, Minister of Health, on Saturday you said that at the end of the evening, at the end of the day, we would have had 13 people at Cora Hospital. I think now we only have 12. Can you just give us an idea what you meant by that? Because, it leads to a lot of speculation that you have information that you're not sharing with the public. So I just wanted you to clear that up. One, and secondly, do you think that these new cases is the beginning of a second wave in Trinidad and Tobago?
Okay.
Thank you.
So the information I had is what was given to me by the Chief Medical Officer. I could tell you right now in Cora we have 11 persons, and in Covert we have reactivated Covert, and we have 1 person in Covert. So that is where we are. As to whether we're in a second wave, we have to be careful how we describe things as waves or peaks. We need to get more information from the contact tracing to determine whether this is a second wave, if it's a peak. A wave, as described by WHO, or the end of a wave, is when you go down to as close to 0 as possible. So at one point in time, and Dr. Hines and Dr. Nandram are free to voice their concerns, we did go down very close to 0. We have seen an upward tick. These cases may not represent a peak at this point in time. The last big peak we had was when we had the cruise ship cohort, 71% of roughly 68 people turning positive. That was a huge peak. So what we are seeing is possibly a second wave, but we are going to wait for the studies coming out of Dr. Hines's activities to determine whether this is a second wave or the start of a second peak. So I hope that answers your questions.
98.1.
Good morning again. Stephen Cummings, 98.1 FM. Good morning to the panel. And my 2 questions quickly, one for Dr. Hines and the other for you, Minister Cox. Dr. Hines, I want to press you further. We've been seeing and witnessing, the spike or somewhat cases, in recent times. Are you at the point where this recent development can be described really in terms of being in terms of us having local spread? Because we've been sort of dancing around that, that term. Are we at a point of local spread? So I'd want, if you can address that issue a little further. And Minister Cox, we've had a situation regarding the entry of election observers mission teams for the 2020 general election. Do you know if there are any plans by the Prime Minister to further address this issue? Because there seems to be some confusion, in the national community as to whether, observer teams will be here or they would not be here. I know that the Prime Minister did issue a statement, but I'm wondering if you would have any information as to if there are plans for the Prime Minister to address this issue further. Thank you so much.
Dr. Hines?
Thank you for your question, Mr. Cummings. We are at the point where we have identified a sporadic occurrence of 4 local cases. In one instance, we have identified the transmission to a family cluster among those local cases. We are in the active process of preventing the sporadic occurrence of local cases from accelerating into what would be called local spread. The actions that we're taking at present are those directly aimed at preventing the onward transmission from the cases that we have identified. Similarly and simultaneously, we are in the active process of tracing backwards to identify whether any other cases may exist in the population. And as we get additional information, we'll be able to characterize the situation better. So at the present time, what we can say is that we've seen local sporadic cases and that we're actively investigating. Over to the Minister.
Okay, thank you very much. Mr. Cummins, actually the Prime Minister addressed, I think that it was addressed comprehensively. I have no additional information, but if there's any additional information, I will get on to you. 91.9.
Oh, hi, good morning, everyone. Thank you very much.
Vern.
Morning. Just quickly, Vern next about 91.9 FM. Looking at how the cases have been developing, my main question with respect to the cases is it possible for someone to contract coronavirus, COVID-19, recover, and not know that they ever had it, or is everyone going to reach a stage where you're going to have to hit a hospital, and will that contribute to the spread? The other question I have is for Minister Cox. In terms of the moving forward and the roadmap to recovery, we saw part one. Could you give us an update on what's going to happen, or what we can look forward, or when we can look forward to seeing a part two, and in terms of what that will speak to? Thanks. Those are my two.
Dr. Nandram.
Okay, Dr. Nandram?
To address the first question, would it be possible to contract coronavirus without knowing and then spread that onward? The short answer is yes. It is very possible for someone to have COVID-19 and not know. It is well documented that some persons are asymptomatic, meaning that they don't manifest any symptoms at all whatsoever. The challenge with that is that if someone does not have any symptoms, they assume that they're completely well. And even though they have coronavirus and they are capable of transmitting that disease onward, they simply don't have any symptoms, and they walk around and go on their daily life as per normal. It is for this reason, among others, that it is critically important that members of the public, as Minister cited before, behave as if they do have coronavirus and wear their masks. This is one of the key measures that we can take to prevent the onward transmission of coronavirus. So please, wear masks. In the event that persons do in fact manifest any symptoms, no matter how minor, whether it's just a mild fever, a mild sore throat, a very mild cough, it doesn't matter how mild these symptoms are. On the first day, the very, very first day that you find that you have any symptoms at all, again, no matter how minor, please stay at home. Do not go to school, do not go to work. Call our hotline numbers and get tested. All right, I'll leave the other bit of that question. Back to you, Minister.
Yes, thank you very much. Thank you. Actually, I'll get back to you in a little while. We have part 1, 2, and 3. So probably you didn't see part 2 and part 3. So I will get some information as to exactly what was addressed in part 2 and 3 and get back to you before this press conference is over.
Let me just add something. The interrogation of coronavirus at a technical level, infection, reinfection, is all well and good. And as we say all the time, there is so much we don't know. So the interrogation of the issue is welcome because information is power. But in light of the fact we don't know so much, the wearing of masks, and I don't want people to think that we are just harping on this. The wearing of masks is what is going to save us all. So let's interrogate the technical aspects of COVID as much as possible. But bearing in mind what we don't know, assume everybody around you has it, assume you have it, and if you wear a simple mask, we could come out of this in a very good position. So the message has to be, wear masks, stay home if you are ill, isolate yourself if you are ill, don't go to work, don't send your children to school, just stay home if you are ill and get tested. Thank you.
Thank you very much. TV6?
Morning, everybody. Urvashi from
Morning,
TV6.
Urvashi.
My question, first question for the principal medical officer. I'd like to find out, we've been getting reports that some persons entering the country legally through legal ports of entry, that they are not staying their 14 days in either state quarantine or state supervised quarantine. Our information is that some people are allowed home quarantine. I would like to know if you could say for certain that every person entering TNT legally is either being quarantined or state quarantined for 14 days. That's the first question. Second question, I'd like to know why have you all stopped giving us the tally of persons who are quarantined at the heliport? Thank you.
Okay, so the heliport, as we have stated before, is under the direct control of the Ministry of National Security, not the Ministry of Health. The heliport is where, and Minister Young addressed this on Saturday, I believe, and other press conferences. These are where immigrants are housed before they are sent back to Venezuela. And that locality is not under the direct control of the Ministry of Health. We provide supporting services. Okay? And then Dr. Nandram could speak to the other question.
So to address the question as it relates to state quarantine, what I can say definitively is that everyone that comes in legally into Trinidad and Tobago is subjected. Everyone, without exception, is subjected to 14 days of state quarantine. No one gets to go home and spend time, in their home. Every state facility has been inspected and there are protocols in place to ensure that persons staying in those facilities are not at risk to any other persons in that facility and not a risk to the members in the public in general. So to reiterate, every person entering legally into Trinidad and Tobago is subject to 14 days state quarantine. Thank you.
Thank you. Guardian Media Limited.
Hi, morning, everyone. You all hearing me?
Yes, loud and clear.
All right, morning, everyone. Rashad Khan, Guardian Media. I have two questions, one for the Minister of Health and one for Dr. Hines. So, Minister, my question is pertaining to what we've been seeing right now. So, today we now have a second school basically out of service because the students and stuff need to be at home and the facilities need to be sanitized, and that now basically puts them out of action for SCA. So I understand that SCA falls under the remit of the Ministry of Education, but bearing in mind that no ministry right now or any other governmental organization does anything in isolation without consulting with the Ministry of Health first, especially in this COVID period. So does the Ministry of Health have any plans or will consider advising the Ministry of Education to move up the SCA date or something like that so that we don't see any further occurrences of students being out there and have any possibility of being exposed to the virus? And now my second question to Dr. Hines. Right now we're listed as having sporadic cases, but now seeing that we now have a number, I've lost track, I can't remember the number off the top of my head, but we've seen a number of cases across the northern region of Trinidad and Tobago. Would we see or could we expect us to be, our category to be changed to seeing clusters of cases? And if not, at what point could we expect to see that happening?
Okay, thank you, Rashad. So I'll take the first question. As you rightly said, the issue of SCA and the date is the domain of the Ministry of Education. The date was set via cabinet note, so any alteration of that date will not be the remit of the Ministry of Health. If we are asked by the Ministry of Education to provide any technical advice, medical advice, we stand ready to do so. But you are quite right when you stated that is the domain of the Ministry of Education and or the cabinet. So I don't know if Dr. Hines wants to attack the second question.
Thank you, Minister. So the question, again, very valid. At present, the designation that we have is sporadic cases. The cases that we have seen pop up so far in the local population still count as sporadic. We have seen onward transmission in one family cluster, but as you would note, the situation is changing daily. As we reassess, we may at some point need to address whether we need to redesignate, but at present, as it stands at this moment, the sporadic case designation will stand pending additional information coming back from the testing of the contacts that we currently are following. So we haven't changed designation yet, but if we need to, based on what's happening with the information coming back from the contact tracing and testing, then that will be done as appropriate.
And also redesignation of cases, we send the information to WHO and they advise us as to how we should redesignate the country. So all this information that we are gathering since these cases popped up from last week Wednesday or now, all of that will be sent to WHO and they will make the final determination. Okay, Richard? Thank you.
Thank you. CLC? Nadaline? Okay, we're not getting CLC, so we would go back to Express. I saw Express hands is up. One question, please. We go back to Express with a question.
Good morning again. Kim Mojam from the Express.
Either
the doctors, but also the Minister of Health. Minister, I know that non-communicable diseases has been one of a focus of yours since you came into office. I would like to ask, if possible, the state of health of our working force, unscientifically, let's say between 25 and 50, a very broad swatch. What's state of health of people in that group? Are we suffering from a lot of NCDs? Are we more vulnerable, a critical group that you would want to keep carrying the country forward in times of crisis? Are we more vulnerable because of our lifestyle habits? And hopefully not a second question. In other words, are we seeing more people in this age group falling to NCDs and dying as a result? And can we put this in the context of COVID and our vulnerability?
Sure. Thank you very much for the question, Kim. As stated on first coming into office, when we did the analysis of Trinidad and Tobago, we were then a hotbed for NCDs. We were a global leader, a regional leader in NCDs, the incidence of diabetes, hypertension, obesity. We have made significant strides in the past 5 years through our joint efforts with the Inter-American Development Bank, where we took out a loan for roughly $50 million to drive the NCD program, which has as its main objective, if I remember correctly, a 25% decrease in the incidence of NCDs, I think by 2025. We have made significant strides, especially with our children, with the banning of the sale of soft drinks in schools. We have had almost 100% compliance with schools, and the incidence of soft drink consumption by school-age children has gone down significantly. So our children are on the way to becoming healthier juveniles, teenagers, and so on. We have started up the Diabetes Wellness Center at Eric Williams. Last year, to date, the figure I could remember off the top of my head is roughly about 3,000 persons take advantage of that, which means that is 3,000 persons who will not be repeat visitors or repeat customers at our A&Es. As a matter of fact, our A&E admission for NCDs, the last figure which I had, which is about 7 months old, is about a 2% reduction in visits to A&Es for NCDs. Now, a 2% reduction doesn't sound a lot, but when you think about 2% of over 1 million visits to A&Es, 2% of 1 million is a large amount. So we have made significant strides in reducing the burden of NCDs amongst our most vulnerable populations. We continue to do that. One of the big projects that we want to sign off on in the near future, hopefully before August the 10th, is an NCD program to have a national screening for the first time in this country of pregnant women for diabetes. Too many of our pregnant women in the public health sector are diabetic, hypertensive, and as I said earlier, they turn up for their first screen late into their pregnancy in the second and third trimester. Almost 40% of our pregnant women turn up way too late, and that is the reverse in the private sector. So we want to reverse those numbers. Also, I can't remember the exact figure, but cancer screenings have gone up significantly in our public health institutions. So I would like to think the roots for a healthier population, tackling the issue of NCDs, have been firmly planted, and I hope that this continues after August the 10th as government policy moving forward. Thank you very much, Kim.
Thank you. One question from Newsday.
Yes, hello again.
Yes.
Ryan Hamilton Davis again from the Newsday. If you just permit me, two small ones instead of one big one. How concerned are doctors right now that there may be gaps in contact tracing? Information that the patient might not have remembered or might have lied about. Let's be honest about. And
what is the question, please?
How concerned are doctors that there are gaps in contact tracing?
All right, we'll be answering that question.
Dr. Hines.
Dr. Hines?
Thank you for the question. That is one of the main concerns that we always bear in mind when we do the questioning around contact tracing. We will ask questions, we'll come back and ask again or ask in different manners. We will provide cues to help jog memory because it is sometimes quite difficult to remember all of the places that persons may have been and may have visited. One of the great benefits that we are having at this point in time is the fact that the hotline is being utilized by persons who believe that they may have been in contact or who have information that they may have been in contact with a case or with a contact, so they may have been exposed. Those persons are utilizing the hotline to bring their information to the fore. So where there are gaps in the transmission of information from the cases themselves, some of these gaps are being backfilled by the use of the hotline. We'd like to encourage that to continue. And as you pointed out, we do want to encourage all persons whom we are questioning, all persons whom we are asking about their contacts, their activities, to be as honest and as forthright as possible, knowing that that is a variable over which we don't have external control. We're going to have to rely on members of the public to be honest in answering the questions. We're going to have to encourage persons to be honest about the places they've gone, the people they've interacted with, because the gaps generated by dishonesty can create a route, an avenue for transmission that we are unable to detect and trace. So we want to emphasize the importance of that exact thing, the importance of being truthful when we're asking you about information, you're sharing the information on your whereabouts. And we also want to encourage the public to utilize the hotline to provide any information that they believe may be pertinent. All of that information is filtered back to our unit. Thank you.
Dr. Nandram?
Building on the contribution of Dr. Hines, it is critically important that persons be very open, very honest, and very forthcoming with the information that they provide, because this is the basis on which we are able to identify persons that may have been at risk and to reach out to them to ensure that they don't become ill, or if they do, to ensure that they receive treatment. In an attempt to address some of these gaps, the Ministry of Health is moving towards a second layer of testing. We've spoken about previously PCR testing, which is the WHO's gold standard. And this is a diagnostic test, meaning it tells us whether someone today has COVID-19. To support that and to support the efforts of contact tracing, we're introducing a second test, a serological test. And what this test will tell us whether or not someone at some point in the past, outside the testing window of the PCR test, has been exposed to COVID-19 and subsequently recovered. So what the situation is, it's likely to be in the very near future is that persons will be subjected to not one, but two tests, one PCR and the other a serological test. And in so doing, we'll be able to answer two questions. The first, whether this person has today COVID-19 or whether they had COVID-19 at some point in the past. With that new bit of information, that at some point in time, this person had COVID-19 in the past, it enables us to do two things. One, identify other persons that may have been in contact with this new person, and to link epidemiologically, as Dr. Hines was saying before, whether going back, being able to trace the source of the case in front of us. So this new type of testing should help address some of those gaps.
Thank you very much. I want to answer the question, Vern's question concerning roadmap to recovery. Vern, actually we had part 1, 2, and 3. Part 1 provided an introduction to the members of the roadmap committee, the sectors being addressed and their mandate for work. Their work was based on the need to have the economy recover quickly as possible in the wake of the economic hit caused by the pandemic. Part 2 provided a synopsis of the major recommendations in various sectors. Part 3 shared initiatives to be actioned in the short term to aid recovery. And Part 4 will look at what has been implemented since the completion of Phase 1 and what can be expected in Phase 2. TV6.
Thank you again for the opportunity.
Hi.
Minister, you've always said that anyone entering TNT can be tested for COVID, and that includes people who are here illegally. What happens if they do test positive, or let's say a positive person has indicated that she has had contact with an illegal immigrant, and that person is traced, he's tested, and is positive? Are they handed over to national security? What happens there? Thank you.
Okay, so anyone who is tested positive receives treatment, regardless of nationality. Once you are positive, you receive treatment. That's the long and short of it. Okay?
And that's it?
Yeah.
Yeah, okay, good. We have Guardian Media Limited. One question, please.
All right, yeah, good morning, everyone. You all hearing me?
Yes.
Yes, we are.
Hello?
Yes.
Yes, we are.
Yes, we are.
Yeah, okay. I assume you all are hearing me, so I'm just going to go really quickly with my
Sure.
question because I'm watching the time as well.
Yes.
Okay, so Minister Dial Singh or even Dr. Hines, could you let us know how much of taxpayers' money now has to be spent to do the contact tracing for these two persons who were ill and did not stay home and went about their daily business? And with that in mind, is the ministry or government considering any sort of legal action against persons who do not adhere to the recommendation that if you're ill, stay home?
Okay, so that's a question for me and maybe Dr. Hines afterwards. So I would have gone to Cabinet months ago, before the start of the COVID episode in Trinidad and Tobago, with a cabinet note requesting $150 million for the Trinidad response to COVID across the 4 RHAs, 150 million TT dollars. The TRHA, under separate cover, because there's a separate reporting function, would also have received or been given another $50 million for their response under their RHA. So the total response is budgeted at $150 million. In response to a question on Saturday, I believe, in a sidebar with the Minister of National Security, not in the public domain, I allowed the PS to actually run the figures of what we have spent so far. Up to Saturday, the estimate spent so far is in the vicinity of about $50 million. But we don't have that granular detail to tell you we spend X $1,000 on contact tracing per person. But there's a lot of budget headroom for $150 million for the COVID response for all aspects: rental of facilities, paying of people, testing, PPE, ventilators, and contact tracing. So those are the numbers we are playing with, but I can't give you a granular detail that it costs X dollars to contact trace one person.
Okay, do we have another person? Dr. Hines, you want Dr. Hines to comment?
If Dr. Hines could add to it.
Dr. Hines, any comment?
Sure.
A short comment, please. We are out of time.
Quick comment is that while we may not look at pursuing any sort of action against persons who have been moving around, presumably unintentionally, there is legislation or there is documentation that it is an offense to withhold information intentionally. So we would want to encourage people to be as honest as possible when we do ask them about their whereabouts, because to withhold that information is actually an offense.
Thank you very much. We've come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. And as we go, I wish to remind you that we are still living with the COVID-19 pandemic. This means that we have a personal and collective responsibility to stop the spread of COVID-19 in Trinidad and Tobago. We know that as the economy reopens, wherever the virus is present, it will move with us as we move around. Therefore, we must do all in our power to observe and follow the public health guidelines. The new upsurge in local cases is a reminder that we cannot drop our guards. We simply cannot lose the health and economic gains we have made in the fight against this pandemic. It is strongly recommended that we wear masks, and it is also strongly recommended that we follow our simple but effective public health guidelines to protect ourselves and our families. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe, save lives. May God bless Trinidad and Tobago.